Edie and Amy Cole, and basically what we are about is providing solutions for the postpartum challenges that moms face, which includes pain relief, breastfeeding, and just generally making the first few days and months after delivery a bit more comfortable. So we had a chat 2 weeks ago about vaginal deliveries, recovery, things that help, things to look out for, and all that. And I think I found that chat very quite engaging. We got a lot of contributions from our viewers. We also asked our viewers to give us some questions as well, and we have about 2 of them. I personally haven't had a cesarean section before, but I have assisted in cesarean deliveries. I have managed patients post cesarean section, and what else? I've had 4 epidurals in my life, 4 spinal, which is the most common form of pain relief that's offered for cesarean sections. That is, in simply put, an injection in a patient's back to numb the area from about, let's say, your belly button down, to numb the area, so that instead of having to put you to sleep completely, you're awake but pain free, and they can carry out the procedure quickly. Okay, first of all, I'll define cesarean section, and it's more or less when your care providers, your obstetrician has to, young working mom, has to make a cut. Please let me know if you can hear me clearly. Has to make a cut on your tummy, through your skin and into your womb. Fantastic. And into your womb, in order to deliver a live baby. I'm going to emphasize live baby because in medicine, there's a difference between a cesarean section and what they would call a hysterectomy, which is when, for example, unfortunately, a baby passes on in the womb and has to be brought out in that way, without inducing the mother. So a cesarean section is actually making a cut through your skin and through all the layers of tissue into your womb in order to deliver a baby. And though in Nigeria, or Africa in general, cesarean section rates are quite low compared to other parts of the world, and there's also still a lot of stigma and bias around it, both in certain cultures, in certain let me just say certain cultures. I think most cultures frown upon it, from the get-go. It's just with time that things are changing. People say things like, oh, if you don't push your baby out, you're not a real woman, or you're lazy. Or I've heard people say things like they've been called obanjes before, for having to have their babies through cesarean sections, and all this is just totally unnecessary and untrue. Whereas in other parts of the world, they're actually even having a problem of having too many cesarean sections. In a place like Brazil and also the US, the cesarean section rates are quite high, relatively high compared to us. And then the reason why this is, obviously you just have to look at 2 different cultures. The reason why this is because there's a trend just like we had with formula, giving the baby formula and breastfeeding, there was a time when it was considered that it's only poor people that breastfeed their children because they can't afford formula. Formula is supposed to be like premium. There was a time, in the 80s. In Brazil, it's in some places they believe that if you're rich, then is what they call what they call it, too posh to push. If you're rich, then hey, you can afford the cesarean section, so do it and all that. There's no need to suffer, and then also there are also places where, because monitoring labor, I mean, you don't know when baby is going to come out, right? And especially for a first time mom, it could go up to 12 hours, which is the cap of normal, and so for them, they're like, ain't nobody got time for that. So especially if you're going to labor on a Friday or something, or just schedule for a cesarean section, bring baby out and all that, move on with their lives. But obviously a cesarean section is still a surgery, and there are risks, and there's a cap on really number of children you can have if you have a cesarean section. The cap is actually about 4, because with each surgery, depending on how you heal and scar tissue and all that, things may become more difficult. And then also for legal reasons too, if they don't want to, because of the way things are structured, having a cesarean section, they are actually also more in control of what's going on, and control of when baby's coming out and all that. So if they're a bit jittery about how the labor is going to go for any reason, they can just offer the mom a cesarean section, and obviously she still has to accept and all that. But then, these are the reasons why it's higher in other places, higher in the US and and in Brazil, like for legal reasons. I personally was offered one because I was offered one, but this was because they didn't have access to certain information about my medical history, and once I was able to prove that it wasn't necessary, I was given the go ahead, and then I had a vaginal delivery. But it was mainly for safety reasons. Yeah, okay, so we've defined it. Now the whys. Okay, there's another thing I was going to add. Some people feel that cesarean sections are more expensive than vaginal deliveries, which is also, I mean, let me just use this opportunity to answer a question that someone asked. Oh, why is the cesarean section more expensive? If you're having a vaginal delivery, you can actually even deliver in your house as long as everything is fine with the baby, and just naturally, as long as you're not your pelvis is the right size compared to the size of a baby and all that, you can actually deliver a baby on your own. But with the cesarean section, there are a number of layers. First of all, the number of people who are involved. You're going to have like 2 people performing the surgery itself. You're going to have someone who's going to provide pain relief, that's the anesthetist, and he uses medication as well. He has to monitor you when your baby comes out. Also, there's a nurse and a pediatrician who have to receive the baby, assess the baby and all that. So we're already talking about like 4 or 5 people involved. Sometimes you may need to be transfused. Sometimes, you have to have fluids and all those things, all the equipment. So all those things come with a cost, all those things come with a cost. So that is the reason why cesarean sections are more expensive than vaginal delivery, because of the amount of input that needs to be put in for a cesarean section to take place standard. Yeah, so that's the reason. So I'm glad I've answered that question. So yeah, and so in our environment, you also have situations where, for example, a patient has been offered the cesarean section and they decline because they are suspicious of the doctor, in the sense that, why are you offering me a cesarean section? Okay, so you want to take more money from me and all that, so that's a consideration. It's more expensive, but as I always say, medicine is something that's based on trust. You have to trust your provider, trust that at least your provider should be able to explain the reason why they're offering you cesarean section, and then also trust that your provider is going to act ethically and has your best interest at heart. So that sort of thing shouldn't cross your mind. You shouldn't have to have that sort of relationship with your provider. If you think your provider is someone who's trying to upsell or whatever, then I don't see any reason why you should be, in that hospital and all that. So it's based on trust. There's so much that you don't know about. There's so much that you can't control. So I don't think it's a good idea for you not to trust your provider enough to not suspect that they are trying to shaft you or get excessive amounts of money from you. Okay, so we talked about trends and all that. Okay, so the reasons why a mom can be offered the cesarean section include things like there are issues with the placenta. I don't know, I've heard of something called placenta previa, which is where the placenta is covering. There are different grades, different stages of placenta previa, but what happens with it is that if a mom goes into labor and her cervix opens for the baby to come out, you end up ripping some of the vessels that are attaching the placenta to the wall of your womb, and then the bleeding can be excessive, can be as in you won't be able to control the bleeding. So in order to prevent that, they just go in straight for a cesarean section. And then also when you have things where another thing called abruption, where there might be bleeding behind the placenta, for this one the baby is at risk, so we have to go in quickly and get the baby out. If a mom is in labor and the labor is not progressing the way it should and it's taking longer, then they have to have a cesarean section done. There are so many things that can make the labor to take longer than it should. There might be something preventing the baby from coming down properly. Maybe the mom's pelvis is not wide enough for the baby to descend, or maybe the baby is too big, so that's relative. Things like fibroids or other masses that can be preventing the baby from coming down. And then a previous cesarean section is an indication for another cesarean section. Also if the reason why the first cesarean section was done is still there, also if you've had a cesarean section before, there's something they call trial of vaginal delivery, and what that means is that your doctor is going to say, look, okay, we're going to try and allow you go into labor, but they will take a lot of precautions, in the sense that you're not going to be giving drugs to make your womb to contract stronger as you ordinarily would if you're having a vaginal delivery, because your womb can tear, and then they're going to be very, very, very careful. So they're going to get ready for a cesarean section, and they also get ready for a vaginal delivery. So if things don't go according to plan, they go just take you straight to have cesarean section done. So that would be failure of vaginal birth after cesarean section. Then there are also certain conditions where it's not a good idea for a mom to go into labor. If a mom has a heart problem, so if they find out that the baby is struggling, baby is in distress, you have to have a cesarean section to get the baby out quickly. And baby is too large, the normal weight for our own environment is about 3.5, about 2.5 to 4.5, but I mean, even from 4, a baby is large, considered as large, so and the baby may not be able to come out easily. So when we have what they call a malposition, which is when the baby, for example, wants to come out with their bum, ordinarily they could come out head first, but if they're trying to come out bum first, you can actually deliver a baby bum first if the bum is just the bum. But sometimes if the baby has one leg dipping down, because there are different types of breech, one leg dipping down and then the other one up, there's no way you're going to be able to safely deliver that baby. So that's the sort of breech that would warrant a cesarean section. But they and then also the baby has to be within a certain size for that breech delivery to go on.